Hey guys, Kim here, and you are tuned into Kim E, the Diabetes MP, a place where healthcare providers can come and learn more about diabetes management through the lens of preventative care, provider patient engagement, as well as culturally responsive care. Now, speaking of culturally responsive care, I wanted to come on today and share with you all an experience that I was able to be a part of. Now, I recently partnered with the organization Shift. Many of you may know who they are. They're very active on social media here on YouTube as well as Instagram over at Shift Nursing. But they recently put out a film, a new documentary called Who Cares? A Nurse's Fight for Equity. And I was able to view and review the documentary. And right after I viewed the documentary, I shot my initial thoughts. And so, what I'm going to do is insert my initial thoughts on video right after I finish talking here, and then I'll come back a little later and I will wrap it up. So, let me tell you a little bit about this documentary. This documentary follows psychiatric mental health nurse practitioner Whitney Fear. She and her family, they are members of the Oglala Lakota Nation, which is a Native American nation. She grew up on the Pine Ridge Reservation in South Dakota, and her culture, her background was the leading thing that inspired her to become a nurse and then a nurse practitioner. And so this documentary really takes some time to highlight the community, a community that many people may probably didn't even know existed, but then also highlight some of the challenges that she and her staff have had to face, and challenges that this community faces when it comes to healthcare. Now, something that was very interesting to me, and kind of surprising as I was watching the documentary, was the common themes that different marginalized groups have. Now if you don't know, I am Black and I am a woman. And so being a part of two groups that are marginalized, just as I was listening to the different struggles that the Lakota people have, I couldn't help but see some of the common things. Though each individual group is different, when it comes to health equity, it's really, in some ways, very simple and very parallel. Our experiences are very parallel. So, and one of those things is the lack of access of care, like the access to high quality care. One of the things that Whitney pointed out was that when she was growing up, she saw a lot of death. She also made the note of that many people didn't live past their 40s. And I just thought to myself, wow, like, what if they were able to access the care, and then not only just access the care, be able to have proper follow-up, right? And another common theme was being misunderstood. Whitney talked about a situation of a patient that, a part of their culture, they have different beliefs, different practices, and this particular patient was speaking to their provider about it, and the provider took it as the patient needed more psych meds. And she made a point here that if you knew the culture, you would understand what he was trying to tell you a little bit better. And I just thought that was wonderful, because as a Black woman, many times I myself feel misunderstood. Like, you don't understand. Sometimes you don't feel understood as a patient. You don't feel like people are really trying to hear you. And I really was like, wow, this is something that is very common across the board with many different marginalized populations. Now, that takes me to my next point, and just the need to be curious as a provider, right? It would be foolish of us to think that we're going to know everything about every population known to man. And even I, a person who is a minority, even a person who has worked with a number of diverse populations, even I don't know everything about everything, right? And I was thinking, just the thought, as she was talking about the patient that was prescribed a lot of psychiatric medications, I was thinking to myself, what if that provider was a tad bit more curious? What if that person asked a couple of more questions? You know, just seeking for clarity, seeking for understanding, just being curious. It was very eye opening for me, and really, even I was thinking to myself, you know what? Even I need to be even more curious and ask more questions and try to really seek to understand my patient population that I care for. That brings me to my last point, which is representation matters. And I think as providers, we can do this a number of ways. It can be lived out, practiced many different ways. For one, I want to applaud Whitney for doing it in a way of this is the community that I grew up in. This is the culture that I grew up in, and I am inspired to take care of my people. And I am going to go get the necessary training, and I'm going to come back and I'm going to serve them. We definitely can do it that way. I do advocate for people hiring those in the community, those who are a part of the demographic that you serve, hiring them into your clinic. You know, Especially this would definitely cut down on language barriers. This would cut down on cultural barriers because you have someone there who can connect with the demographic as well as teach the rest of the staff. Because truth be told, you may not have someone that you can hire from the community. So then what do you do? Which takes me to another way that you can practice this is partnering with those in your community. Being in the community so people see you and that you're building a rapport with them and that you're partnering with organizations that can be that bridge for you in your practice. Um, Also, I would definitely say, like I stated earlier, being curious and learn, right? No one is expecting us to know everything. I don't believe our patients really expect that from us. They understand that, intellectually, everybody understands that. Everybody wants to be seen and heard, but everybody also knows that you can't know everything about everything. And taking the time to be in the community, taking the time to read up about the culture that you see, to be a part of some of the customs and the cultural events that may be in the community, I think that would help us so much as providers to understand who we're actually taking care of. All in all, I would recommend any nurse, any healthcare provider to watch this documentary. It was so beautifully done. It highlighted a group of people with such a rich culture. And again, a group of people that many may not even know exist, right? And then also, it reminds us why the fight for health equity is so necessary and how, though we've come so far, we still have so much work to do. Okay, guys, I hope you all enjoyed my commentary over the film and my initial thoughts over who cares, a nurse's fight for equity. What I'm going to do now is link the trailer so you can view the trailer, get you a little idea of the documentary for yourself. I'm also going to link in the description box the link to the full documentary if you're interested in watching. I highly recommend that. And I'm going to leave all of Shift's information, all their social handles, so you can go and follow them and learn more about what they're doing over on their platform. Again, you've been sitting here with Kim E., the Diabetes MP, and I'll catch you on the next one. Bye.
If you own a pair of Crocs, even though you know they're super ugly, you might be a nurse.
I'm Whitney Fear. I'm a psychiatric mental health nurse practitioner in Fargo, North Dakota. I'm Lakota. I grew up in the country on the Pine Ridge Reservation. I see patients across the lifespan for treatment of mental health conditions and substance use disorders.
I don't think she's ever given herself enough credit for the impact that she makes on other people.
Yeah, she's tolerable.
She is going to have vulnerable conversations with people in a way that makes them feel like they're cared for.
I always say it's the essence of Whitney. You have to just understand how really good she is.
Asking people how they want their care and what they think is possible, because that is communicative of respect rather than compliance.
Riding in my Indian car.